The female doctor developed a posterior occipital position during childbirth. The midwife directly used her hands to correct the fetal position. Half an hour ago, the female doctor who was about to give birth was still seeing patients. However, when a colleague looked down, they discovered that the female doctor's water had suddenly broken. She quickly had someone send the female doctor to the delivery room and called for the best midwife. However, despite the female doctor using all her strength to give birth, the baby just wouldn't come out. At this point, the female doctor was already exhausted, and her blood pressure was gradually rising. The obstetrician quickly performed an examination and found that the fetus was in the wrong position, with occiput-posterior position stuck in the birth canal. The obstetrician suggested an immediate cesarean section, but the female doctor directly refused, believing that it was not yet necessary to perform a C-section. Just as the obstetrician and the female doctor were arguing, the midwife beside them expressed that she could try to manually adjust the fetal position. After careful consideration, the female doctor decided to let the midwife give it a try first. The fetal position was quickly corrected. However, before they could celebrate, the obstetrician opened the ultrasound and found that the fetus's head still hadn't turned back. She demanded that the female doctor immediately undergo a cesarean section. The female doctor still did not agree. The midwife once again attempted to correct the fetal position.
Breathe, breathe, breathe. Try it now. I think we have it.
And this time successfully adjusted it. At this point, the female doctor, who was exhausted to the point of collapse, successfully gave birth to the child with effort. However, due to the umbilical cord being wrapped around the neck, the child was no longer breathing. Upon hearing this, the female doctor instantly broke down. The midwife quickly stepped forward to provide comfort while the obstetrician began emergency resuscitation. After everyone's strenuous efforts to save the meconium blocking the fetus's airway was completely suctioned out using a suction device. Hearing the sound of the child crying, everyone finally felt relieved. This drama is called Chicago Med. Due to copyright issues, I can only show you up to this point.